long COVID, not everybody suffered from long COVID, did they?
Well, I don't know if we know what, when you say not everybody suffered from long COVID.
I mean, I suffered from what and I've written about it, where I will suddenly become extremely confused. I will have a mental fog that will just descend upon me. I will be grasping for a word that's quite obvious, and it might last a day, it might last a week, and then it just flew away. Is that what you're talking about, or are you talking about some physiological disease, ailment, whatever, that might be afflicting us in the future?
The latter, unfortunately. And now's not the time to create fear or concern, but the science that we are now looking at, I'm going to give you some example. I'm working very much with Dr. Carl Skadon in Mount Sinai. He's done more autopsies in patients who have died without having been infected with COVID. And what we're finding now is months, 7 months, 10 months. Now there's a paper showing 15 months, that this virus resides in the body in every vital organ, brain, gut, pancreas, lung, for months and months and months. A virus that persists, or genomic sequences that persist, have known long-term consequences, which at a later time we should discuss.
I mean, the one I immediately think of course, is HIV, which lives in goodness knows how many cells and different types in the body, which is why it's almost impossible to eradicate it.
Exactly. It's now been shown that this virus goes into a thing called monocytes, deep into the bone marrow. So the concern for that is there's 7 known viruses that cause cancer.
Are we moving to a situation that life looks normal, except in China, but we just don't know the long-term ramifications of this virus?
Unfortunately, when you say we just don't know, there are a few people who do know. And that's what...
What would you like us to do? Do you think we should all go back to wearing masks more frequently than we are?
Completely.